Welcome to Thrive, Alabama. It's great to be a part of an organization that helps thousands of people every year with quality health care. I want to take you on a little tour and tell you more about it.
At first glance, we may seem like any other doctor's office, but we offer health care plus so much more. Our entire staff is committed to providing high-quality health care for people from all walks of life. At our Huntsville location, you can receive care for children and adults, whether you need an annual checkup or immunizations, or need healthcare management for conditions such as high blood pressure, HIV, or diabetes.
I am so glad to be back in North Alabama. Thank you, Thrive, for having me. I couldn't have asked for nicer, more welcoming coworkers. Everyone cares so much about the patients and minimizing barriers to care. From the front office staff to our MAs to our nurses, case managers, behavioral health, and my fellow providers really do care about the patients and each other, and their empathy is contagious, but in a good way.
We occupy just over 21,000 square feet of space at our Huntsville location on St. Clair Avenue. Primary care, pediatrics, our lab, nutrition, and case management are in Building 3. Our patients benefit from nutritional counseling from our registered dietitian. Our staff of case managers work to reduce barriers to care and assist patients with a host of services, including medical interpretation, transportation to your appointment, and insurance application assistance. When we formed as the AIDS Action Coalition in 1988, we were responding to the need for specialized care for people living with HIV. After becoming a community health center, we began seeing patients of all ages for primary care. Most recently, we added pediatric care.
Working with pediatrics is not a job, it's a joy. Knowing that each day provides a new opportunity to show encouragement and education to a young family or to provide care and understanding to a child in need are some of my favorite things about being a pediatric provider.
Our wellness clinic in Building 7 is where we provide STI care and PrEP. PrEP is a daily pill that prevents HIV-negative people from acquiring HIV should they be exposed. Building 9 is home to our behavioral health services, including our substance abuse intensive outreach program called The Den. Primary care patients can access our counseling services via an internal referral.
One of the most exciting things about being a part of Thrive Alabama for the last 5 years has been watching us grow as a federally qualified health center, including our behavioral health department, which now serves more than double the number of people it served and has twice as many staff.
Health education is in Building 8. Staff there work in the community at schools and health fairs providing education and free HIV testing.
Being a part of Thrive Alabama has allowed me to help the community by providing HIV testing and even this year, COVID testing.
Responding to the needs of our community is in our DNA. We partnered with Huntsville Hospital and the City of Huntsville in 2020 to offer drive-through COVID testing to thousands at locations throughout Huntsville. There were huge testing events that saw 300 to 400 people and smaller events with around 150 people, including local churches and homeless camps. We are fortunate to have a clinic on wheels we call Thrive Mobile. It features a handicap-accessible exam room, bathroom with specimen collection, and testing areas. We take it to public events where we do education or tests for HIV, diabetes, COVID-19, and more. As a community health center, our goal is to provide quality health care to as many people as possible. We welcome people with Medicaid, Medicare, TRICARE, and private insurance. Plus, we offer a sliding fee scale for those who qualify.
I hope you've enjoyed that short tour, but there's more for you to learn about what we're doing at Thrive and what we're planning for the future.
We serve between 4,000 and 5,000 people in our current space, but we have plans to serve more than 14,000 in a new state-of-the-art medical center. The first floor of the new center will have patient eligibility, a greatly expanded behavioral healthcare department, a full-service lab, and an on-site community pharmacy with drive-through. A large classroom space that can be divided into small rooms can be used by our staff as well as rented to other nonprofits in the area. On the second floor will be adult primary care, pediatrics, and case management. Each medical pod will have a nurse station, provider offices, and 8 exam rooms. Case management is located here for easy access to patients who need social work. On the top floor are services that will further benefit our patients. Our nutrition department will have a training kitchen to allow our patients to learn how to cook healthier meals, whether for one person or a family. Our STI clinic will feature the same pod design as our medical suites on the second floor. 2 services we now send out on referral will be brought in-house, a dental suite and vision suite. Offering these services in-house will be more convenient, efficient, and affordable for our patients. Finally, the third floor will also be home to our administrative departments.
It gives me such joy to be the CEO of an organization that has grown from a small specialty clinic to an organization that cares for thousands of people every year. Very soon, we will be moving to the corner of Oakwood Avenue and Washington Street, where we will be in a state-of-the-art healthcare center, which will serve 14,000 people from all walks of life. Remember, when one thrives, all thrive.